Irregular or missed periods can mean lots of things. Menopause can't be! Oh, then what the heck is PCOS? Isn't that a phone plan? What's up, ladies? I'm Madge the Vag, and today we'll probe the topic of PCOS. Do you know what PCOS stands for? And I'm not talking about Metro PCS.
Okay, no idea.
No. I should know this, I don't.
No.
No. No.
Not even gonna try. Okay, well, let's welcome Dr. Michael Lewis, OBGYN and pelvic pain professional. Can I call you that?
Sure.
Great. We're talking about PCOS, polycystic ovary syndrome. That's a mouthful. Did I get it right?
Polycystic ovarian syndrome.
Polycystic ovarian syndrome.
A syndrome has a couple of symptoms in
Okay.
it. And so typically it's abnormal periods. You may have abnormal hair growth, either on the face or the body.
Oh my.
And also you may have polycystic ovaries. And you typically can have 2 out of those 3 symptoms in order to call it the syndrome, polycystic ovarian syndrome.
The hair thing has got me triggered here. Now, I could have had this since I was a kiddo. I have hair all over the place. Should I be concerned?
It's possible that you developed it from a young age, but typically it's because of excess male hormone, the androgen, in your body, that may be producing the abnormal hair growth.
Okay, so it's not necessarily this that's causing me to have hair all over the place.
Correct.
Okay.
I mean, abnormal hair growth is another topic on itself, but that may be one of the symptoms of polycystic ovarian syndrome.
Let's get to the point. What is the cause of this?
We're not exactly sure. What ends up happening is that the woman is not ovulating. You end up having these unruptured follicles, or what you appear as cysts on the ovaries. With that, you may have infertility, and this is the leading cause of infertility in reproductive women. And as well, there's other medical problems that can happen later on in life because of the PCOS condition.
Well, can we just back it up a little bit? Can you tell us what exactly a cyst is?
Right, so when we talk about a cyst, we're talking about what's in the ovary itself. And what happens is that with polycystic ovaries, the actual cyst themselves, or these little follicles, are supposed to mature. Eventually will release an egg, but these do not mature, and they stay immature, and they get arrested in this specific phase, and again, they will then be around the outside of that ovary, and you can see on an ultrasound these, what's called a ring of pearls around an ovary.
Well, that sounds pretty. Now, this is something, you're not sure of the cause, but it is something that can run in the family?
Yes.
So if my mother has it, I might get it. This is something I could blame her for also.
So there is a genetic component to it, but it's not to say that if one of your relatives does have it, that you're automatically going to get it,
Okay.
but you're at risk for having it as well.
Let your doctor know if you have it in the family.
Correct.
You can have it and still get pregnant. It doesn't mean you're done, or does it?
You still can get pregnant with PCOS, it just may be more difficult.
Okay.
And that's why if you are finding problems in terms of ovulating, or if you are having problems getting pregnant, there are medications that can help do that.
Is there anything you can do to prevent your hormones from behaving this way and not get PCOS?
You can prevent it from happening, and what you do in terms of treatment is really treating the symptoms. In regards to the PCOS, in regards to fertility, you may need to use certain medications to help you ovulate. And it's also recommended that women who have PCOS, generally because they're not ovulating, they may be at risk for problems with the lining of the uterus later on in life, in terms of developing cancer of the uterus. So we actually would put them on a birth control pill to help regulate their cycle, help them ovulate, and help the lining of the uterus slough off every single month to decrease that risk of developing cancer in the future.
You can develop PCOS in your teens or early adulthood, but it does take time to diagnose. So talk to your doctor if you're suffering from any of these symptoms. We know it sounds scary, but it can be managed. I'm Madge the Vag, and if you have any questions or comments, put them in my box. My inbox, that is.